Hi, I'm Claire and I'm a certified Pink and Steel cancer rehab therapist. The following video is a demonstration on how to complete diaphragmatic breathing. Whether you've just been diagnosed, if you're currently undergoing cancer treatment, or if you've completed cancer treatment, diaphragmatic breathing is a very beneficial practice. It's also known as abdominal breathing, and it is a technique that is commonly practiced at the start of a lymphatic drainage sequence. It is a slow and deep breathing method where we use your primary breathing muscle, which is known as your diaphragm. Your diaphragm rests at the base of the lungs. It's a dome-shaped muscle and it's our primary muscle for breathing. So when you incorporate a diaphragmatic breath and when you practice this technique on a regular basis, it's a much more efficient way of breathing. So it can help in terms of conserving energy. It also promotes relaxation by slowing your heart rate and your breathing rate, which is especially beneficial for reducing stress and anxiety. Because of our connection between the diaphragm and the pelvic floor, this particular technique is especially beneficial for those who've been diagnosed or undergone treatment for gynecological or prostate cancers. As you breathe in, either through the nose or through the mouth, the air coming in that fills your lungs, the diaphragm contracts and it moves downwards, making space within the chest cavity for your lungs to expand. As this happens, the lower belly will also rise and expand upwards. And when you breathe out, the diaphragm relaxes, it rises up back to its downward shape again, which helps to force the air out of the lungs, and the belly will naturally fall or hollow. So we're going to practice this particular technique lying down to begin with. So you can practice this in your own bed, or you can lie down on an exercise mat as I'm demonstrating. So just getting yourself into a comfortable position to start with. You can place a pillow underneath the head so that the weight of the head is supported, and resting one hand on your belly and one hand over the chest. The knees are bent up and the feet are supported downwards. And just coming to settle into the position to begin with, relax your shoulders. And we're going to start this technique with a very gentle breath out. So slowly just pursing the lips and releasing the breath. And as you inhale, visualize a little balloon in your belly and you're going to fill that balloon with air. So as you breathe in, feeling the belly rise and expand and swell upwards into the hand, and as you exhale, feel the belly dip and hollow away from the hand. So we inhale, the belly rises, and exhale, purse the lips, release the breath, and the belly gently hollows. So this is not a forceful breathing technique, just encouraging that breath down to the base of the lungs on the inhale, and exhale. Release the breath slowly and gently. So in your own time, breathing into the belly, feel it rise up into the hand, and exhale to release the breath. Now, if as you're practicing it, you feel a lot of movement in the upper hand, the hand that's resting over your breastbone or your chest, this is not uncommon. And sometimes if we're in pain or if you are under stress or anxious, typically the upper chest can often be involved a lot in our breathing pattern. And you may find yourself shallow breathing or breathing predominantly in the upper area of the chest. Be patient, be as comfortable as possible in the position, and just concentrate on the breath out. So lengthening the breath out with each breath. So again, breathing into the belly, and exhale to release the breath. Inhale, the belly rises, and exhale, the belly falls. And you'll find with time and with practice in a relaxed position that the movement of the chest will be minimal, and the predominant movement that you'll feel is that rise and fall of the belly on your inhale and on your exhale. Now, if you've been diagnosed with lymphedema, or if you have been advised to practice lymphatic drainage sequence, then you may find it helpful to place both of your hands on your belly. And as you breathe in and you feel the belly expand up into the hands, just providing a little bit of light pressure downwards on the exhale. And this movement provides additional compression to allow the lymphatic fluid to drain into the vessels around. We have a number of lymphatic drainage vessels in the abdominal region. So breathing into the belly. And as you exhale, a gentle downward pressure to assist with the drainage of that fluid. So we breathe into the belly and exhale to release the breath. The diaphragmatic breath can be drawn in through the nose and out through the mouth. Or if there's difficulty breathing in through the nose, you can breathe through the mouth and out through the mouth. Pursing the lips can help to lengthen the breath, and drawing the breath in through the nose just helps to warm and filter the air as it makes its way down to the lungs. So again, continuing your breath into the belly. Exhale to release the breath. And this is a practice that you can practice every day. If you are completing your lymphatic drainage a number of times in the day, it's very beneficial to commence with this particular practice before you move through the movement series. And similarly, this can be completed as a standalone practice for relaxation, and it can also be a really useful practice for carers or those that are looking after clients with cancer as a way to manage stress and to promote relaxation.